I just wanted to talk about anxiety and stress because I don't think it matters where in your diagnosis you are, whether you're newly diagnosed or whether you have had treatment before, whether you have recurrent disease. Throughout the trajectory of your disease, there will be times when you do feel anxious and you do feel very, very stressed. And talking to patients, these are the things that they said to me really had caused them stress along the way. New diagnosis, just the uncertainty and the unknown of living with a disease that can go into remission but can come back, that may not be fully cured, that at some point may come back or increase. Treatment decisions. There's a lot of we heard Dr. Hourigan talk before, and there are a lot of treatment options now, and making the decision that's best for you and having enough information. Fear of the disease returning. Finances and time off work. I hear most patients when I go in to see them, they do bring this up because time off work, time away from the family, paying bills, the unknown of what things are going to cost can be very, very stressful. Managing appointments that they've never had to manage before, possibly, trying to fit them into daily life. Caring for the family and changing family roles. So it may be that you're the person in the family that looks after finances, that does all the organising, and it may just mean that your partner or your children who may be growing now need to take over and help you with that. So people do find that quite stressful, that some of that control, it could be, is taken away, and the partner may find that it's quite stressful then having to take on roles that they've never had to worry about before. Caring for your family and changing family roles, or just being overwhelmed by how much there is to know. If you Google or you pick up a book, there is a lot to know, there's a lot to take in, and it can be very stressful. So what can we do, or what can you do to help cope with this anxiety and stress? It's really important to talk to others. So share your feelings and your fears. There are lots of groups out there to help support, but a group might not be your thing, and that's absolutely fine. It might be one-on-one is better for you, and there are a lot of healthcare professionals that you can talk to, whether it be through the Leukaemia Foundation, the treatment centre you go to, in the hospital, the ward, the nurses that you usually see, your doctor. Make sure you have somebody that you trust and that you can talk to. It's really important. And just make sure that you talk to your healthcare team and let them know how you're feeling so that they're aware of it. Take an active role in your healthcare. It's really important to ask questions. The more you know, the more empowered and in control you can feel. So make sure you have enough information when you walk away. When you're given options for treatment, make sure you've got enough information to go away and then make those treatment decisions. It's really important to have a support person with you, because I know when I'm given a lot of information, you only take in part of the information that you're told. And especially when you're feeling quite anxious or stressed, it's a very good idea to have somebody with you that can jot down notes, take away written information as well, so that you can go back and have a look at that later on. It's very important. Bring a list of questions. Now, the big thing that I see when I talk to patients is they say, I don't know what to ask. I don't know what I don't know. So what I try to do is give them, and this is just one example, there's many examples out there of asking questions is important, and this one is through the Sydney University and also the Cancer Institute of New South Wales. And they have one for whether it be questions to ask your haematologist, questions to ask your radiotherapist, questions to ask your medical oncologist. And it's a list of questions that you can tick the ones that pertain to you, so that when you walk in, you don't feel overwhelmed, you've got your questions written out in front of you, and it can prompt questions that you didn't know that you needed to ask. So patients have found that really helpful when they go to talk to their doctor. Stay in touch emotionally. It's really important to listen to each other's feelings. It's really important to have emotional endurance as well. So don't let negative thoughts or little things rob you of your energy. Remember, it's okay to be frustrated and sad, and there's no right or wrong way for you to react to a situation. Lastly, or well, not lastly, treat yourself is a really important one. Do something you enjoy doing. Don't give up all the things you enjoy because of your diagnosis. Make sure you still treat yourself. And learn strategies to cope with your stress. Now, for everybody, this is different, whether it's relaxation, exercises, yoga. We have art classes at the Wesley, which a lot of our patients come and sit and do art, and they just find that really relaxing. It gives them time and something for themselves. So whatever you find helps you cope is perfect for you. The next thing I just wanted to touch on briefly was fatigue, because this is one of the first symptoms that patients say that they feel. They're fatigued. It's one of the last symptoms to go away, and between 70 and 90% of all oncology patients will experience fatigue at some point, whether it's from the disease itself or whether it be from treatment. Most patients experience fatigue at some point through their journey. So to everybody, fatigue means tiredness, lack of energy. Cancer fatigue can differ in that it doesn't always go away with rest. So it's an all-consuming feeling. When we look at the causes of fatigue, it could be an increase in the body's need for energy. Now, while your body's trying to repair itself, it takes a lot of energy. So if your body's repairing itself post-treatment, it's using all its energy to fix anything that's wrong, whether it be, like I said before, mucositis in the mouth. It takes your body a lot of energy to do this. Weakened muscles, cancer treatments, emotions. I think we all know when we've had a really emotional day how incredibly fatigued we are at the end of that. It's exhausting. A lack of sleep and poor nutrition. Now, if you talk to any of the oncology patients that I've met, they will say fatigue is described as, they say it's unusual, it's excessive when we're talking about cancer fatigue. It's a whole body experience. It's not related to what you do. So you may not have done anything that morning, but you're feeling incredibly fatigued. And it's not helped by sleep. So I thought this was very, very cute. So what can we do to help fatigue? It's really important to keep your current level of mobility. And we've got one of our doctors at the Wesley is incredibly passionate about patients with myeloma. If they don't need to be in hospital, then they should be out doing what they normally do, keeping up that level of activity that they usually do. Good nutrition. Ensure that you're taking in enough calories, protein and nutrients to give you the energy to do what you need to do throughout the day. Psychosocial, so looking after yourself. We've just spoken about the emotional burden that a diagnosis or something changing in a cancer diagnosis can have. It can be very tiring. So trying to reduce your levels of anxiety and stress has an effect on fatigue. Rest. So we've just said it's really, you are to keep up your levels of mobility. It's really important to engage yourself. Even though it takes a lot of energy to engage yourself, it's really important to engage yourself. But it's also really important to rest on bad days. Save your energy for what is really needed in your day. Distraction is great. Doing something fun, escaping from your fatigue, doing something that you really enjoy is an amazing boost. And relaxation therapy. So relaxation techniques could be listening to music, it could be doing yoga. Limit your caffeine at night is a really good tip. I know that's something that I need to do. Get into good sleeping habits is really important. But if you find a relaxation technique helps to give you good self-care and limit your fatigue, it's really important that you continue to do what you enjoy. So the question was, how do we, if somebody who is incredibly fatigued, how do we get them up and moving? What can we do? It is really hard because they are experiencing a real fatigue. With some patients we've just had to find, and it sounds silly, but the thing they enjoy doing, the thing that motivates them, whether it be the thought of getting home and getting closer to home, whether it be something that they just physically enjoy doing. We also get the physiotherapists involved so that at least once a day there's no choice. Yep. And a lot of the time it does take a lot of encouragement from the allied health and the nursing staff just to come into the room and say, I know you don't feel like it, but we've got to sit up, we've got to go for a walk, and once they're up and moving, they feel good for it. It's just engaging.
It's good here, but we're more concerned about
when you head home. And it's just that constant encouragement, and there does need to be a balance between rest when you do feel fatigued, but keeping up your current level of mobility.
So we've got a neighbour.
Yeah. But there are also other services such as in-home physiotherapy services, and it depends on where you are in funding, and there's a lot of, you know, different circumstances, but it's also something that can be looked into as well, whether it be coming back in for a day rehab program, so you're at home but coming in each day, or whether it's somebody coming to you to ensure that you're keeping up with the levels of mobility that you require. So they're all things that can be looked at.
We need to have those extras.
It might just be sourcing those extras. So a lot of those extras can be sourced through the Leukaemia Foundation. So it might just be, I mean, I look at the hospital setting because that's where I'm based, but there are a lot of patients having treatment who don't ever come into the hospital, which is wonderful, which is what we want. So it's just sourcing those extras through where you go to. So whether it be through your GP, it could be extra help that you need at home, or something as simple as that. Go to your GP. Just have a healthcare professional that you can go to and say, this is what I want to source, how can I go about it? Have the Leukaemia Foundation's number, give them a call and say, do you offer this? Or can you point me in the right direction of where I can go? Because you don't want to be in hospital if you don't need to be. Being out of hospital is the best place in the world. So it's sourcing those things outside.
Thank you.
Yeah. Oh, thank you very much. Thank you.